Good afternoon, everyone. Thank you for joining us on this special Facebook Live. I am here joined by our Regional Health Director, Megan Avalone, our Town Administrator, Jim Gilday, and our Police Chief, Chris Battalora. I just want to take a few moments to make a few comments, and then I'm going to hand it over to these guys to give you an update. But we are in uncharted waters with this coronavirus, but I want to reassure all of you that we are indeed in good hands. We have gotten through 9/11, Superstorm Sandy, financial crisis, and we will get through this. I remain in contact with Senator Booker, Congressman Malinowski, and Senator Kane's offices, and participate in a daily call with the county where we get updates that are provided from the governor's office. We all have to agree, though, that our lives are about to change. They have already to some degree, while new norms are being established. But the one thing that we have always done exceptionally well is come together as a community in times of need. Each one of us is going to have to play a role in this fight. While you may think that you are not considered vulnerable to this virus, each one of us has an obligation to protect those who are. Today, we want to give you an update on what we're doing to prepare, what you could expect from us in the days and months ahead, and how we can use your help. So Megan is here to provide you an update on the status of the coronavirus in our area and measures you should take if you feel sick. But first and foremost, we are focused on mitigating the rapid spread of the virus to allow our healthcare system time to adequately care for those who are sick. To that end, we are implementing social distancing measures and have canceled all events on town property through April 19th. You can check out the full list of postponements and cancellations on our coronavirus webpage. And Town Administrator Jim Gilday, he will be providing an update on town operations and what measures we are taking to ensure we can continue to serve the public. Secondly, you can help us support our most vulnerable populations. If you are a senior citizen, a caregiver, or a family member of one, please provide your contact information so that we can include you on updates about what resources are available to them so that they can stay in their homes and avoid contact with the general public. To be placed on this list, you can email westfieldnjseniors@gmail.com or call 908-301-1287. And all of this information will be listed on the website. And Chief Battalora is going to address what his department is doing to help those who may need assistance. We've also set up a dedicated email address for any resident, property owner, or business owner to ask questions or request services specific to COVID-19, which is covid19@westfieldnj.gov. And we are compiling this who to contact list, which will be on our website this afternoon. And this replay of what we're doing today will be available on Facebook, YouTube, and TV 36. And thirdly, please make an effort to support our local businesses who are particularly vulnerable and employ many hourly workers. Most restaurants have extensively increased their cleaning and sanitation practices, as well as enhanced their takeout capacity to accommodate the public. Please consider buying gifts from local merchants or gift cards to be used at a later date. I have been in contact with Senator Tom Kane, who is working on a number of bills with other legislative leaders to have a timely and appropriate government response to support the business community through this time of uncertainty. Lastly, I'm sure you just received the news that the Westfield School District will be closed indefinitely beginning on Monday, with remote learning beginning on Tuesday. I also can confirm that the SAT testing that is scheduled for tomorrow will continue as planned at the high school. So thanks to everyone for your patience and your concern, and most importantly for the support of your neighbors and our community overall, and of your offers of assistance. I'm going to hand this over to Megan to talk about where we are from the health perspective.
Thank you, Mayor, and thank you for pulling us together today for this important update. So I want to preface by saying that specific facts and figures that I give today are current only as of today. This is a rapidly changing situation with new information coming out, I would say hourly, but probably even more frequently than that. Currently in New Jersey, we have 29 confirmed cases with one confirmed case in Union County. I'm sure all of you have been paying attention to the news and know that this week the focus has really shifted. Previously, we were talking about containment of the virus, and as the mayor has correctly stated, now we're really looking at mitigation. So what does that mean, right? So what that means is we're really looking at ways to slow the spread of the virus at this time and really try to make sure that a bunch of people don't get sick at once. So we do that through social distancing measures. And even social distancing itself, what exactly does that mean? So what we're asking residents to do is make sure that you don't put yourself in a situation where you're in close contact with a large number of people. So, for example, if you're planning on maybe attending a play, that would not be in the social distancing guidelines. We're asking our residents who can work from home to work from home, and we're really asking individuals to try to stay home as much as feasibly possible. Some of the questions that have come up is, what do I do if I start to feel sick? So I want to remind residents that the first thing, don't panic. We are still right in the middle of flu season, and we are still seeing lots of flu activity in all the communities that we serve. But if you do get sick with a fever and cough, it's really important to remember to call your healthcare provider before you show up. I also want to remind residents that the use of 911 should be used for life-threatening emergencies. If you have a fever and a cough, you can call your healthcare provider. That's probably not a call that needs to go to 911. The same thing with visiting the emergency room. The emergency room certainly should be used for life-threatening or urgent matters, but we really don't want residents going to the emergency room just with a fever and a cough. The other thing that I wanted to make sure everybody's aware of, as we all know, there's lots of rumors going around, and we want to make sure that residents have accurate information. So I'd like to remind everybody that there's three main sources of information that we're referring residents back to for timely and accurate information. That is the CDC website, the New Jersey Department of Health website, and the town of Westfield has a dedicated coronavirus website. We're asking residents to please check information on any one of those three sites before believing something that you may hear from a neighbor or on social media. The State Department of Health has set up a hotline too. Now this hotline's not for clinical information, but certainly it's used for general, timely and accurate information. And that hotline number is 1-800-222-1222. Again, 1-800-222-1222. That hotline is staffed 24/7 and it has the ability to answer questions in several languages.
Can I ask you a quick question about social distancing? With schools being closed on Monday, there's going to be a lot of kids home and, hopefully not too much free time, but a lot of free time. Can you give some guidelines for parents regarding what social distancing means in that regard?
Yeah, so thank you for reminding me about that, Mayor. So the importance of schools being closed is not because we're necessarily concerned about the amount of illness we're seeing in Union County. Schools are being closed because we're trying to adhere to the guidance that we should practice social distancing. Understandably, having hundreds of children in a hallway, in a cafeteria, that's not in line with the guidelines to practice social distancing. But that being said, from a public health standpoint, it's really important that parents understand that if we have children congregating outside of school, whether it's large parties or indoor play centers, that defeats the whole purpose. So I think the ask from a public health standpoint is while schools are closed, really try to have your children also avoid contact with large gatherings as well.
So for the kids that thinking they're having 20 of their friends over for remote classroom learning probably isn't necessarily a good idea.
From a public health perspective, absolutely not. And we are still in the middle of flu season too, right? So just for flu precautions, we would probably advise against that also.
Great, thank you. So Jim, why don't we move to you and talk about town operations?
Okay. Tell my kids they're not going to their friend's house.
Yes, exactly.
So thank you, Mayor. Again, this is, we are in, preparation mode and crisis mode in certain ways. But that being said, we want to make sure that Town Hall remains open, and of course, the operations of town government have to continue. And so a couple things for the residents to know what we're doing here at Town Hall. We are open for business. payments for various things, registering for various programs. Even though we've canceled recreation programs for the next 5 weeks, pool registration remains open for the summer programs and so forth, so those things continue. We're doing, as you've heard of other places doing the same thing, a little deeper cleaning of town hall major touch points, all the doors to the building, the inside bathrooms, inside office doors, not just to protect the public, but also to protect our employees. If our employees get sick, they can't serve the public. So we're making sure that that is being done. In addition to that, also for our employees, we're making sure a couple things. First, seeing who of our employees has the ability to work from home. It's a standard practice. Most people in town, we see that the town parking lot for commuters is rather empty. That means a lot of your businesses have already closed that you go to. You're home doing work. We have people that do have the ability to do that. But as you also know, many of our employees cannot do that because of the type of work they do. But we're working on that now, so we have some remote employee work to be done. In addition to that, residents should know that you can come to town hall, but of course, in light of public health concerns, we discourage that if you can, and we have many ways to do business with us online. You can pay your tax bills online, pay your sewer bills online, you can pay tickets for court online, you can register recreation programs online, register the pool online. And also you can call the office, you can email us. Every department's information is on our website. If you have to ask a question or come in, you can email us, you can call us, we'll be here, and we'll be able to answer your question without having to actually come to town hall. So those are important things for residents to know. We're open for transactional business, but you don't actually have to come here for everything. Also, just a rumor mill piece of business to clarify. In these times, people hear things, as we mentioned before on social media. New Jersey American Water has issued a statement today, and we'll just confirm that statement, that the COVID-19 virus has no effect on the water system, water supply for our town or any towns they serve. So if that's something you've heard, that is not true, and the water supply system is just fine. A couple other things. Public meetings. We're here sitting in Town Hall where the Town Council holds its meetings. The operations of business, of government business must continue. So meetings will continue. Planning Board, Board of Adjustment, Library Board, Recreation Commission, Board of Health, Town Council, and of course, those are public meetings. Again, the Town Council will be here on March 24th. We have a meeting that night. The residents the meeting's open to the public. We are discouraging people from coming in order to provide public comment opportunities. We always film our meetings on Facebook Live, so that will continue. We are working on setting up an email address for public comment to be actually delivered and read aloud at our council meetings in real time. And that'll be done before our next meeting on March 24th. In addition to that, all the other board meetings that are listed, again, people are open to the public. In certain board cases, like Planning Board and Board of Adjustment, there are certain requirements that are required, so people have to be sworn in to give testimony, so they must be present. But we also encourage, if an applicant has an attorney, maybe only the attorney comes on the applicant's behalf, and the applicants do not come, to limit the amount of people in one place. Court. We are also sitting in the room that serves the court. So court, again, that's a very hard thing to cancel. We've already been in touch with our municipal court judge and the municipal county vicinage that runs the court system. And the judges have been advised that they want to suspend court or make allocation of cases to limit the amount of people that come to court at one time. They are at liberty to do that with approval of the assignment judge of the county. So our judge is already looking to do that with his staff here, us reassigning court dates and limiting the amount of people that come here, but court will still operate for the foreseeable future. Lastly, our library. Now with the schools closed, and we know that's happening beginning Monday, the library also is almost a place of even further concern because of the age groups that go to the library, seniors that are a vulnerable population, young children and so forth, everyone in between. So the library board, we talked to them today. They will actually be open today and tomorrow for regular checkouts and other items, but no computer use. And then on Sunday, they will be closing for the foreseeable future as well, so that not to be a gathering place for students and so forth. So that'll be, and we'll have all these updates as well on our website. And I just want to reiterate again, as Megan and the mayor indicated, we have a coronavirus resource center on our website. We're going to update that literally daily. And those have links to the other sites, the CDC site and so forth. And again, as the mayor mentioned, we're getting daily updates from the governor's office through the county. As a matter of fact, after we do this Facebook Live, we'll be jumping on a call with the county to get the latest information. So again, it's ever evolving, and we'll have information to share as quickly as we possibly can. But again, as a resident of the town, like the mayor and I are, don't panic, and we have great people in place to continue to serve the public during this crisis.
Excellent, thank you. Chief?
Thank you, Mayor. Well, I'd like to assure the public that the Westfield Police Department is fully prepared to provide uninterrupted service to the public. I have great concern for the general welfare of our police officers. Keeping them healthy right now is my number one priority, to make sure that we do have an adequate workforce to provide essential police services. We are implementing some revised response guidelines and procedures for our officers when they respond to emergency medical calls for service, in the interest of keeping them safe and not unnecessarily exposing them to any risk.
Move the microphone down a little bit.
I'm sorry. But we are providing services uninterrupted. We are granting our watch commanders, our officers in charge of the station house, extraordinarily broad decision-making authority during this period of time. We are looking to provide vital service to everyone in this town. So if you are a member or a part of the vulnerable population in this community, like a senior citizen or someone with special needs, we will honor requests that are somewhat out of the ordinary, requests to provide services that perhaps would prevent our vulnerable people from exposing themselves to the public unnecessarily, requests for picking up medications and delivering them to your residence. These are the types of things that if there's no one else to provide it for you, we will certainly seek to do that. You can contact us on a non-emergency line and make that request 24 hours a day, but we want to make sure that no one is forgotten about during these tough times. Additionally, we're looking to provide any and all police services remotely that can be provided. Reports that normally require you to present yourself here at the police department or for us to respond to your residence or place of business, if those reports can be taken over the phone, or if the service can be provided to you over the phone, your call will be screened by a watch commander to determine if that can be done, and if so, it will be done. We don't want you to unnecessarily have to come to the police department or have us come to your residence if this can be completed remotely. So we're taking every measure possible to ensure that we're able to continually provide public safety services uninterrupted. And like I said, these are unprecedented times, so we're willing to take extraordinary measures to do so.
Thank you so much. We have received a few questions in advance. I don't know if any have come in through a few. Okay, so I'm just going to read some of these. From our good friend Burham at Adahan Pizza. He said, do you have a list of residents that are alone and incapacitated or have difficulties, no means of transportation? Are there, can we provide a meal train for them or any other assistance? So as I mentioned in my remarks, we are trying to compile a database of residents who might need that type of assistance. And once we get a sense of the needs, then we're going to determine what kind of volunteer database we might want to put together and how we're going to match the volunteers with the needs. So, and there's another question that came from Liz Talmont, who said the same thing about, is there a way to have the town organize volunteers to help those in need in Westfield or surrounding towns? So, yeah, we're working I met with the Lifelong Westfield people this morning, along with our Recreation Department folks who are organizing it. But right now we're just trying to identify the people who have needs, and once we figure out what the needs are, we'll do a call out for volunteers to determine what it is we're looking for. But once again, I just found it incredibly inspiring that most of the questions come about what can we do to help. So I'm sure there will be an enormous amount of opportunities for the public to do that. So stay on the lookout for that. There's another question we got. Josh Goodstead asked about potential food shortages. And maybe this is a question for you, Megan. How concerned should the community be about potential food shortages? Should this occur? What action can and should the community take? And are our local restaurants considering takeout services?
So I can speak to food shortages and what we're asking people to do. So at this time, there's absolutely no reason to think that there's going to be food shortages. But what we are asking residents to do is stock up on a 2-week supply of foods, particularly foods you might want to consume if you're not feeling well. And here's the reason for that. It has nothing to do with we don't think there'll be food in 2 weeks and 4 weeks, but if you start to feel crummy and there's nothing to eat in your house, there's a really good chance that you are going to go to the store while you're feeling crummy to stock up. And we want to make sure that you have those items in your house before you start feeling sick, if you do start to feel sick. So it's truly just to be prepared to keep people, again, social distancing and keep people out of stores while they're feeling sick.
And regarding restaurants, I do know the DWC is working with many of the restaurant owners and businesses to see what they can do to amp up their takeout services. I've spoken to a few myself, and they're fully prepared to do that. And once again, if that happens, I would just please encourage all of you to make sure that we can support our local businesses and use them as much as possible.
Maybe a good time for gift cards, too.
Yes, and as I meant, I'll just reiterate, a great suggestion is, buy gift cards and use them when you get back, or, stock up early on Christmas gifts, whatever it may be, but anything that we can do to show them our support during this time, which we all know is temporary, would be great. Another question came from Jeff Yang. Maybe I think this, Chief, might be for you. Has the town planned to put a curfew in order? So once the schools are closed, kids are not going to run around the downtown area or have parties. That will defeat the purpose. So,
first of all, let me say this. Allowing your kids to go downtown goes against everything, all the direction that we're giving you here in creating social distancing. The answer to your question is no. At this time, there is no plan to implement any type of curfew. Now is the time for our children, their parents, the members of this community to start exercising common sense and to follow the direction that we're giving you, to avoid public places of assembly, not to gather in groups downtown. I will tell you this, the town of Westfield has an emergency operations plan. It allows us to declare a local state of emergency if necessary and to implement such a curfew and other restrictive measures. But at this time, there are no plans to do so, but if the future dictates, those actions can certainly be considered.
thank you. Well, that was all the advanced questions I had. So Kim, did you have any?
Yes, we have a question from Sean Smith asking if the town fields and facilities are open for activities and organizations to use, or are they closed?
Are the town fields and facilities open for recreational opportunities for residents to use, or are they closed as well?
I can refer, yeah. So right now, the town fields are actually in the process of being groomed. Although we have heard from some leagues, I think my own son plays soccer. Soccer has canceled all activities for the next week or weekend. I believe this weekend. And again, in the same vein what we're talking about here today, when you have the NBA and the NHL, for example, canceling activities, local leagues should follow the same pattern, at least for some time. Again, local leagues are privately run, and then they ask for field scheduling on town or Board of Education fields. So right now, usually this time of year, we've had great weather. This time of year, they're being groomed in preparation for opening in April. So the only thing that's really being done now, if anything, would be practices or scrimmages. There's no organized play yet, but we would recommend that the leagues follow suit with everybody else to discourage those groups getting together until we have further information.
There have been a few questions of a similar theme about children getting together for small group play dates, children with those symptoms getting together for backyard play dates. A couple of questions along those lines and variations of what is acceptable or recommended.
So the question is there some guidance for what is considered, a reasonable, like, play date, kids gathering that are asymptomatic in small groups? And Megan, do you have any thoughts on that?
I do. So, we're all trying to navigate this together, right? And we're getting lots of questions where the guidance just isn't clear. But I think the best answer is parents should use common sense, right? What we're seeing now is children seem to be affected less by this virus, which is great for kids. But I think the concern may be for some parents, if you have somebody in your household who's a senior, an older adult, and is immunocompromised, you may want to take extra precautions with your children to make sure they don't become sick. So I don't think there's a one-size-fits-all answer to a question like that, but I do urge parents to think it through and think what might be the best action for your family and your family's specifics. And I know that's not a great answer, but the reality is some of these questions that are coming up, we just don't have the data right now to really have a one-size-fits-all answer.
Is it fair to say that an outdoor play date would be safer than an indoor play date?
So we always say during flu season, during any type of respiratory virus, outside activities are always safer than inside activities. And thankfully, the weather is going to be warmer, hopefully, in the next few weeks. So as a general statement, yes, activities that are outdoors, people aren't contained, people tend to be a little further apart, that's generally seems to be better than indoor activities.
Got it.
Okay, and then we have a question from Melissa asking, are there any precautions being taken by employees that work in our restaurants? If they are sick, can we catch it if they cough while preparing our food?
Are there any precautions being taken in restaurants? So if they're sick, for example, and they cough in the food. I've spoken to one restaurant owner specifically, and he more or less told me that they have all the measures that they're taking, not only to increase their sanitation cleaning services, but I think they've raised the temperature of what they're using to clean their dishes and things like that. And obviously the rest of the workers and wear gloves and those kinds of things. And again, they're following the same guidance that we all are. So I would imagine if there's a restaurant worker that is remotely sick, that they're taking extreme measures. But Megan might be able to answer that.
If I may, Mayor, thank
Yes.
you. So I don't think residents need to be concerned with the preparation of food. I think the concern with restaurants at this point really lies with people congregating at the restaurant. So I would say, as a public health official, there's not really a risk we're concerned about with the preparation of food. Before COVID-19, the Westfield Health Department has started a program where we started to outreach to local restaurants to talk about being prepared just for this type of scenario. So the timing is uncanny, right? But the good news is we started that process and restaurants have been engaged. So I would say absolutely I would feel safe at this point eating food from a local restaurant, and I don't think residents need to worry about catching a respiratory illness from prepared food.
Thank you.
Sparrow would like to know, while in preparation, are you taking into account the eventual national emergency to be proclaimed by the president, which I think just came through in breaking news?
Breaking news. So that's the first I've heard about the national emergency. So what was his question, Burham's question?
While we prepare, are we taking into account the national emergency being proclaimed by the president?
I think we'll have to take that information and figure out what that means for our municipality. And my guess is we have a call at 1:30 with the county, as Jim referenced, so I imagine that will be brought up. And the only thing I could say is one thing that we will all be very committed to. We'll be incredibly transparent and forthcoming with information. We're not afraid to tell you what we don't know, but we can promise you that we'll do everything we can to get the answers that we need, and we're very committed to making sure that everybody feels comfortable with the information that we're providing. So this will not be the last Facebook Live. I think as information becomes available, we'll do these as necessary, as often as necessary if the public finds them helpful. But we want to make sure we are navigating new waters, but I feel really committed and actually very confident, and hopefully you've seen it today in terms of the wisdom and the knowledge and the commitment from our town employees. It really has been quite amazing, and we're really lucky.
One thing I want to say, Mayor, just all the guidance we've been giving, public health officer here and so forth, it's important for the public to understand that it can sound a little scary. It can sound like you're going to be isolated, but as Megan mentioned before, and the mayor alluded to, it's okay to go outside. It's okay to take a walk in the park with your wife or your husband. or your children.
Walk your dogs, yeah.
The goal is not to gather together with big groups of people, but taking a walk in the park, getting outside, getting exercise, that's not a bad thing. So just be aware that you don't have to be isolated. And again, as the chief mentioned, if we're going to have isolation and as those things come to our attention, we're going to address those as best we can, working with volunteer groups like Lifelong Westfield. But it can sound very scary, but it doesn't have to be.
No, and if we ask the right questions about our exposure to vulnerable populations, whether it's people who are immune compromised or seniors, I just think that when you talk about having play dates, just ask the questions of the folks that are coming or going to be around, like who they're being exposed to. And as I said before, this is the time that you want to be helping the neighbors, checking on the seniors, and just, sharing the toilet paper that you can't get at the grocery store, whatever it may be. We are all in this together, and I feel like we will emerge stronger because of this, but we just have to get through this period of uncertainty. Is that it?
Thank you.
Thank you all, and Louis, feel free to write in with as many comments and questions as you deem necessary, and we'll make them available to the public. Thank you all.